this key selling point that all kids, for example, with pre-existing illnesses would be covered. Turns out it's not the case, that a lot of these drug discounts that were at least going to start rolling in this year, we were told, are not. And I don't know what else will on earth, ma'am, but I'm telling you, people look at this and saying, I don't know whether I was sold a bill of goods.
No, I don't think anybody was sold a bill of goods. And look, I feel confident
well, I'll
that
tell you, you know what, Congress? I tell you, those parents of kids with pre-existing conditions, I think they're thinking that.
Oh, we will fix that. I mean, that is a key selling point of this bill.
When will you fix it?
And it's critical. It may be fixed between the House and the Senate right now, and I guarantee that the White House is going to make sure that is changed, and we will do what we have to do in Congress.
But didn't someone read, Congresswoman, the writing finally to say, hey, you know, this thing we thought we had, we don't have. The President's going around the country and in his final remarks championing this at the signing as a done deal. Someone should whisper to the big guy, we read the bill, sir, it's not in it.
I think it was in highly technical language. I actually just learned about that today. As you were talking about it.
Yeah.
But again, I feel like it'll be a technical fix, and we will get it back in there if it isn't.
Well, you know, Congress, I'm no lawyer, and I'm going to defer soon to the judge here, who's a great lawyer. But I have watched a lot of Perry Mason episodes on TV. and I'll tell you, ma'am, with all due respect, I read that portion of the bill where it was clarified. And, you know, even an idiot like me can understand, no, it doesn't take effect immediately. The paragraph is quite clear, over the period of time, mentioning up to 2014. And I'm thinking, you know, well, I mean, I understood that, and I'm not the sharpest tool in the shed.
Well, what are you going to do? I mean, sometimes you can get too many lawyers in the mix, but I guarantee you that's something that's going to get fixed right away.
What I'm asking you, I'm not meaning to beat up on you. I know you mean the best of intentions in getting this going. But a lot of your colleagues apparently didn't read this thing, and now they're standing by something that could be dramatically different than the way it was sold.
Again, I think you may be bringing up an issue that some people are concerned about today, but it will be fixed very shortly, if in fact.
So you think it's limited to just these couple items that we discovered today? Because you know what happens here. It's like when they unearth problems you had in school, and then more problems come out. And I mean, that was my entire school years. I got to tell you, Congressman. But I'm just saying, what new were we going to uncover?
You know, look, I mean, people have talked about the passage of Social Security, the passage of Medicare. I mean, there were giant fixes to that, and many pieces that didn't come into play for several years. And as somebody said to you earlier, this is an enormous piece of legislation, as we've all talked about. We will continue to comb through every piece, make sure it's implemented, and I feel confident we will deliver what we promised to the American public.
Well, the only exception, ma'am, I would make to that, in Social Security, we never told anyone that you're going to get this money the very first year, it's going to be this to the dollar, and then pull it.
Well, most of these things we've been very clear with people what takes until 2014, what we're going to do right away.
This you guys said was now. This you guys said day one. When I was in Washington, I mean, I got pretty tired. I was doing 8, 10 hours straight, I grant you. But that one, I got through my thick skull. That I heard. That immediately. That I understood.
I agree. You are absolutely right. We have promised the American public that children cannot be denied for a pre-existing condition, and I'm sure that we will implement this legislation the way we said.
All right, Congresswoman. A pleasure having you on. Thank you very much.
Absolutely. Thanks for having me.